Welcome to the Breech Birth Podcast. I'm Sasha Hopkins, private midwife, breech birth educator, and your host. This is a space to hear the real, raw, and powerful stories of women who have experienced breech birth in all its layers. Each episode features honest conversations with women who've experienced breech firsthand, offering insight and reflection. This podcast was born from the knowing that these stories need to be heard, to inform, connect, and reclaim the story of breech birth. Whether you're navigating breech birth yourself, supporting others, or simply curious, welcome and thank you. Hi, Mia. Welcome to the podcast.
Hi, thanks for having me.
So just to give some context for those listening on what your story will entail, could you share what year your baby was born?
2024.
And where were you located?
Sydney.
And what kind of care did you receive during your pregnancy, birth and postpartum?
So my pregnancy had a private obstetrician, a private hospital. Then I birthed at a public hospital because they had a breech clinic. And then postnatal, I actually went back to the private hospital for postnatal care. So,
Okay.
yeah, hope that covers everything.
Yeah, great. And how many weeks were you when you birthed your baby?
39 plus 4.
And did you have a vaginal or a cesarean?
I had a vaginal birth.
Beautiful. Thank you. Do you want to share a little background about yourself to give the listeners a detail about who you are?
Yeah, sure. And so I'm a 33-year-old female. I live in Sydney. I've always grown up and lived around here. I am a pet photographer, something a little bit different.
Pet photographer. Yeah, cool.
Love photographing pets and their families, seen a lot of beautiful clients over the years. And I have a background in science. So I actually did a science degree straight out of high school. So I have that background and I worked in the field for about 5 years. Realized it wasn't completely for me, or at least that avenue of research wasn't for me. So yeah, just had a complete change of heart and went to something creative. And still doing that a little bit, but obviously since having Bub, I've been kind of, getting things a bit easier. And yeah, I love being a mum, love animals, love nature, love going out for hikes and little things like that. But yeah, that's me in a nutshell.
Beautiful. That's awesome. And your breech baby, is that your one and only? Have you had babies before?
No, my first baby.
Yeah. Do you want to go into that then? What did that journey look like? Was it a planned pregnancy, surprise? How did you start? And you've obviously had different care providers. So I'm sure the listeners would like to hear about that journey.
So I started off, I feel like I always knew I wanted kids. It was a planned pregnancy. And it came shortly after I had like some gut issues, and I honestly thought I had like worst case scenario situations going on. And I had a diagnosis of Crohn's, and that was sort of earlier in the year. And then from there, it was just like, I want to stop just kind of like working and feeling like I was getting nowhere in life. And we were waiting to buy a house, and that finally was kicking off a little bit. And I was just like, I really want to have a baby like soon. It was always in our plan, but it was just kind of got bumped up a little bit. So it came at a bit of a shock to family, but we didn't try for that long. It was only 3 months. So I feel really grateful in that sense. But I was on the start of my medication for my Crohn's at the time. And then, I was so happy that I felt pregnant. And it was one of those things that you grasp onto. You're just like, as soon as you make the decision, I really want a baby, you're just like baby, 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 like constantly. Yeah. It was such a weird, surreal feeling when I actually took the test and it was positive. I was like, oh my gosh. So at the start of pregnancy, I had a pretty easygoing pregnancy. It was obviously just towards the end with all the breech stuff happening that things kind of got a little bit, different, and it's not scary, but not what I thought it was going to be like. Yeah, the first trimester I was just really tired and a little bit nauseous here and there, but nothing that big. And so originally I did want to go for MGP. And unfortunately, that didn't really work out. I kind of got a bit upset at how they were just kind of like, oh, we'll just put you on a wait list and we'll let you know. And it's like, well, I want to know whether it's a no, because I'm not just going to wait around. And we had private health insurance, so we always knew it was an option to do private obstetrician. And I went to the antenatal appointment at the local public hospital. And I didn't really love the first appointment I had. And they were just like, well, because you've got Crohn's, you're going to have to see a whole lot of doctors throughout, and it's going to be like really disjointed. And I just didn't like the feeling of that, especially for a first baby. And it just didn't feel nice. So I was like, well, let's have a look at private OBs at private hospital, and went and saw one and actually called around. I wanted another person, but then she was the only one who had availability for when I was going to be giving birth. And she was really lovely, and it just felt right. Like she was just really, really nice. And yeah, I feel like I asked all the usual questions. I felt at ease with her. Obviously, I didn't, think about the fact that breech could have been a possibility and what would happen there.
Yeah.
But being in a private hospital, I kind of over time was like, oh, maybe I didn't exactly pick the best model of care because I know that I don't want to be fully against private because I still had a really good experience with them. But just kind of knowing the stats are a little bit against you in some ways. But I really loved, knowing that I could have the same OB at every appointment and she was going to follow me along. And she didn't seem like Crohn's was a big issue. She just said, you can have some growth restriction towards the end, so we'll just keep monitoring, put me on some extra growth scans towards the end. For the most part, everything was good. And it was probably around about 28 weeks when I went for a growth scan, and they were just like, baby's breech, and they were doing measurements. And I had ended up getting that scan redone because they just weren't happy with the measurements. Well, let's do it 2 weeks later somewhere else. And I just didn't like the terminology around like people were saying like, oh, baby's in a bad position. I just really hated that.
Because they'll breech?
Because they'll breech, yeah.
Right. Yeah.
Only 30 weeks, like, okay, like babies can move. But yeah, I just didn't like how people would say things like that. And there was a bit of a worry at that point that baby was on the smaller side. I think by then it was like the 15th percentile. The reason it had to be redone was because they thought it was like the 10th percentile. They were worried about the abdominal circumference. It's like, I'm a smaller person. My mum, she had 5 babies and 4 out of 5 were like pretty small-ish, around like the 3 kilo less mark. And so to me, I just felt there was that genetic factors there and it felt normal to me. I didn't think that was an issue, but it was just something that was being flagged, which I think was just like in the back of my mind of, oh, this is a bit upsetting. And I feel like I really had to advocate for myself a little bit that everything was fine. And then I think it was probably around 30, 32 weeks. I was just noticing that I was feeling quite a lot of tension, tightness and soreness and stuff in my back. And I didn't know what was really normal per se, but I knew that pain was always telling me something. And I was trying to figure out like, okay, is baby breech, is this a problem? But then also recognizing that maybe I wasn't feeling the best in terms of my body. Like I was staying pretty active, not too active, but like, not
finding a balance.
Yeah, finding a balance for sure. And so I think I had a pregnancy massage was probably the first thing, or I went to go see a chiro. They were like very close to where I lived and they were like, yeah, you're very tight. And they did a lot of release work, and the massage, like the masseuse was a pregnancy one and she was lovely. But I loved how I actually sat down with you at the start of the massage and talked to you about your pregnancy and what you're struggling with. And I'd mentioned that I had a breech baby and she was from the UK and they do a lot of home births there. And it seems like everything's kind of like normalized over there. And she's like, I've had 3 or 4 breech births. And I love that she shared that with me. And she was sort of sharing, her viewpoint on like a lot of obstetricians, they're just trained in surgery and they don't like these things that aren't normal, but it is a variation of normal. And I just loved how she gave me that kind of just that
different perspective.
Yeah, very different perspective. I hadn't really talked to my OB much about the breech because she wasn't concerned. It was probably only around the 36-week mark she started being a bit pushy on cesarean kind of thing. But I didn't really think anything different until then. But it was nice to hear those stories beforehand that it was just a normal part of birth. And it was hard because I obviously had my own views of birth as well. Like my mum had 5 pregnancies and it didn't seem like she had that many complications or anything. And there was no need for surgeries. And I don't know, it was just kind of like, that's just what I saw birth as, like a really physiological process, and wasn't really scared of it or anything like that. And even the chiro that I saw, he was just like, then you can go to this hospital if they end up being breech still. And I was like, oh, thank you. That's just, nice to hear. But then I was trying to figure out, like, was there a reason why they were breech? Do all the things like the spinning babies, the moxa, the acupuncture. Oh, going crazy over it. So I really wish that I didn't.
When did you start doing that to try and turn baby?
It was probably around the 32 weeks mark. Like I felt like that was quite early. Like it was just sort of starting in my mind of like conversations that I was having with people. And probably definitely hit a peak of like just doing a lot and spending so much time on an ironing board upside down, like just the crazy.
Such an awkward position to try and get into, especially pregnant. It's hard when you're not pregnant.
Exactly. And even just getting up off the floor, you're like, oh, my head feels weird, but you do it.
Yeah.
But I loved with the moxa that like when I was doing it, you could feel the baby moving. So it was obviously doing something, maybe making a little bit of space in the uterus or something. But he would always move around when I was doing it. So I was like, oh, this is kind of nice. Maybe, yeah, more of a ritual or something going on. And then I saw an osteo who was also local, and he was really great. We had talked a little bit about ECV, like with my OB, but he was just like, yeah, let's do it. Let's see what we can do like for you. And he was really great at working those muscles and releasing a lot of tension. And he was just like, baby's responding to some things, like he'd kind of move a little bit, kind of like that sort of semi-transverse. But then I'd think maybe something was happening and then nothing would happen. So he was just a little bit like confused as for maybe it's too late, that kind of thing. So I kind of like made my peace that I didn't think that I could really do much more myself.
Were you offered a ECV at all?
Yes, I was. When I started talking to, so I think it probably was around the 36-week mark, and we went to an appointment with our private OB, and that's when she decided to bring it up. I think she must have just been having a bad day. Like she was running late. She was never this blunt about things. She was running quite late with appointments, and she was like, "Oh, well, let's just set a date and we'll book you in for a cesarean just in case." And I just hated that from the get-go. You know, she knew what kind of birth I had wanted. Obviously, I know you can't plan these things. I get it, but I just felt like there was this complete lack of control, and yeah, I just kind of lost all hope a little bit there for a minute. And I pushed back, and I was like, no, I don't really want to set one. And so she's like, you know, we can try something. We can try ECV. And at that particular hospital, they had never done them there, but she'd done them at public hospitals before. So at least it was nice to know she's done them before. So yeah, I think we just kind of got off on the wrong foot. She's like, you know, you could go for a vaginal breech delivery if it doesn't work. You'd have to go to this hospital. And she wasn't so sure about what their protocols and stuff were. Like they had a breech clinic, and there's only a few in Sydney, so it was nice to know that there was an option. And I had faith that they'd seen a lot of babies go through there on the birth. So I feel like it's hard to sometimes remember little bits of details. But anyway, I walked away from that was feeling really discouraged. I was just like, well, if this baby doesn't turn, it's not going to be a great outcome. And it was kind of like a shock of like, okay, I know I need to actually be a little bit more realistic. C-section is a reality in birth, like it can be a reality. So I need to actually plan for it if it does happen. But that wasn't going to be my first choice ever. And
sorry, had you ended up having an ECV or not? As you offered one, but did you opt in for it or not?
Yes, I did. So that came a little bit later. So it was 37 and 6. So it was nearly 38 weeks that I had my ECV with her. And I didn't mind the experience. She was actually pretty gentle. I had 2 ECVs in the end. I had one with her and one with the Breech clinic at the public hospital. And so the one with my private OB, she was very lovely about it. And she actually managed to get the baby transverse, but just couldn't get his head to go the rest of the way. But I feel like she just approached it with such a nice manner and really calm, and what I needed. When it was such a weird experience to be given like the tributylene or whatever it's called to relax the uterus, I just felt really shaky and just kind of out of it. And I was very curious as to like what it was going to feel like as well. And it just kind of felt a little bit uncomfortable, but also kind of a little bit like you're being winded slightly. Bit crampy and winded, yeah. But yeah, I was just really happy that, you know, she gave it a go. He was able to be moved a little bit. I wasn't willing to give up hope because I had already booked in with the other breech clinic to do another ECB. And that was going to be like the last to try. Yeah, I think a few days before the ECV, I had my first appointment with the Breech clinic, and my partner and I were both feeling like, what was the point of going private if we're just going to end up at a public hospital? You know, it just seemed so wrong. Like, why? I get that that's just what it is, but you know, that it was kind of sad that Breech was just a lost skill, and that my OB seemed quite scared of it, and which was hard not to let that rub off on you as well. But once we had the appointment with the Breech OB, she was like, their team was so lovely, and I from the get-go just felt so, you know, they're normalizing it and it's normal to them. They deliver so many of them. I felt so at ease and reassured, and that I was with skilled providers, and I had asked so many questions and there was no terrible contraindications or anything at that point. Baby being smaller wasn't a concern to them, and even though there was a little bit of concern with my private OB, they weren't concerned, which was just a nice feeling overall. And so I felt like I had that in the back of my mind. If the ECV fails, like I do have a backup plan. Yeah, I really wanted to be able to explore that option. And yeah, so then the second ECV came, and I remember Breech midwife at the public hospital. She was like, "How are you feeling?" She was trying to gauge before it happens, like how it was probably going to be if it failed. And I was actually really in a positive mindset. Like I knew that I had this backup option, and I was willing to pursue Breech, even though there was definitely some doubt creeping in my mind a little bit, just, really wanting him to flip, but just the extra risks and things. But yeah, feeling okay. And it was nice. She was just a really warm personality as well. So that was helpful. And then when it failed, honestly, it was like the most terrible ECV I've ever had. I really wish that I didn't do it, but I couldn't have known because they were just very forceful. It was very different to the first ECV. I just don't know how it was so different, but they were just very like digging, and I just felt like they were like putting a knife in there and stabbing all around. It was just so unfortunate that it was like that. And they were just like, we just can't get his butt out. And like at least, the other OB, not even a week earlier, was able to get his butt out. It was just interesting.
Yeah, very interesting to hear such different descriptions, and good for the listeners to hear that it can be very variable depending on the healthcare provider doing it as well.
Yeah, definitely. And it's weird because even the person who was doing it, he was one of the Breech guys, he was one of the big dogs. He sort of joked around. He's like, "You want me to try? Like, I've got a big fail rate," because like obviously he'd done a lot of them. But it was all fun, and that was nice to take the edge off. But yeah, they're so different. And I think like as soon as we called the end of that, I just burst down into tears. I don't know, it was such a release of emotions. I did not expect to do that in front of so many people as well. It's a bit of a scary shock of like, okay, well, I guess we're definitely going through with this now.
Yeah.
And it was nice because they stood around and they talked with me for a while and calmed my nerves a little bit. I think I just needed the drug out of my system because I was feeling so shaky, But yeah, and then so that was 38 and 4. So that was actually a week before I delivered. Yeah, I think they were just like, well, no, we're happy to like let you go 10 days over. They really wanted spontaneous birth if we were going to do vaginal breech delivery, which I 100% agreed with. I did, if they were going to let me go 10 days over, I was going to push it even further. I knew in the back of my mind, I'll do as many CTG monitorings as you want, as long as we're all happy. And yeah, they were just a very lovely team. And I feel like I really felt so reassured by the Breech OB. Like she was going to be on call pretty much for all the Breech births at that hospital, and just knew that I was happy to put my faith in her. And anything that she said, it was just a really special, unique bond there. I put my trust in you. Like this is a really vulnerable time. And I don't know enough about Breech. I was always intrigued by birth, like my whole life. And Breech wasn't something I ever thought would. So it was definitely different. And then, yeah, they booked me into the public. The plan was to go to birth at the public and then go back across to the private the day after.
Yeah, okay.
They weren't too far, probably about like 20 minutes, maybe half an hour max. I think there was just a little bit of uncertainty there whether I'd be able to go back and whether they would accept me, and if I ended up with a C-section, like what would that look like? And I think there was just a bit of like stress like that I just didn't need. But I had faith in the process and trusted that it was going to be okay. So then I ended up having another scan for baby on the Friday. So I would have been 39 and 1. And I also had a CTG monitoring that day. And like all my CTGs, every time I went and got them done, like even like the day after the ECVs, you have to go back and get them. Baby was just like always crazy and like moving around so much. And I realized afterwards because their head's not really locked into anything, it's just moving. And that was always a problem for like the team because they were like, we need to see the rest. And it's like, he just let me go. Like, I feel like I was being held hostage there all the time, which I thought was just funny. But yeah, I had to like leave to go to the scan. I was like, okay, I'm going to go. And they were like, yeah, we're going to let you go. But I loved how they would like, if anything starts happening, you call us. And I was actually starting to feel some cramps that day. So it was really kind of exciting to feel that and actually see on the CTG, like the uterus numbers, like going up a little bit. Like I think they were only at like 30 to 50, which was pretty low, but something was like starting. This is exciting. And went to get the growth scan, everything. It was okay. Like nothing had really changed. It was pretty much just to get data for them so that they would be happy.
Before Bub was measuring on the 15th, had that improved?
Yeah. He had actually dropped, I think it was probably more like 10th. And they were more worried about the abdominal circumference, which I think would have been lower than 10. And that was sort of where their worry was. But then I also was very aware that when you have breech, it's harder to measure things. Also, just towards the end, things are harder to measure. I never doubted that he was okay. Like I always sort of knew he was fine, but it was just one of those things where maybe the growth had slowed down, but it wasn't enough to worry too much.
No. Sorry, did you know what type of breech
Yes,
he was?
he was a frank breech pretty much most of the time, and I always felt his feet up the top, like bashing against the side. But every now and again, like in scans, he would have maybe 1 foot down, 1 foot up. So he would sometimes probably go between complete and frank.
So he had a bit of space then.
Yeah, he did. But yeah, they were also saying like with Frank, it's the best one for birthing, because it's the safest, because the cord can't come down, and it's just the best one to be able to get them out that way. And so yeah, that was nice to know and reassuring, even though it might change. But yeah, so over the weekend, I had definitely let fear kind of take over a little bit. It definitely upset me a little bit that I did let that. Because I didn't know a hell of a lot about Breech. I was on Breech That Waters watching the videos and kind of like, oh, it was just hard to digest. And maybe I shouldn't have done that in hindsight. But yeah, I was just very curious as to like, okay, what's actually going to happen and how does this differ from a head down baby? And one of the things that I had asked the Breech OB was about the end. I knew that babies come out a little bit more limp. And I was like, but why is that? And she's like, it's because of the causing compression when the head's coming through, because the umbilicus comes through first, and then obviously you've got the compression with the head. And she was explaining it really well. Like that's why we've got a rule of they want the head delivered within 5 to 7 minutes or something like that. I was like, yeah, okay, well, I'll put my trust in her. She knows what she's doing. She'll make sure everything's safe. But it was still just kind of getting to me a little bit, and different things were getting to me over time. And it was really hard because I had put my trust in a lot of other friends and was talking to them about just how hard the situation was. And then there were some family members that were just not on board, and they were very much wanting to tell you how they felt about it. And it's like, well, but I'm this baby's mum. I think I get that there are things that can happen that are really stressful and that you can't plan for, but I'm going to try and do everything in my power to help this baby arrive safely. I just really didn't need that in my mind. I was trying to be so positive and trying to get into that mindset. But yeah, my partner ended up having to just be like, we're not doing anything against medical advice. Please do making this more stressful. And they apologized and everything. But it was just one of those things that you let it get in your mind and you wish that it didn't. Because I get it. It's outside of the norm and people aren't used to that.
Yeah. Sounds like your partner was good at setting some boundaries there for you just to protect your space.
Definitely was. Yeah, I feel like it was hard for him also because he took a while to get on board, but as soon as we'd found these, people, he was on board. And so he was realizing that it does take a while, but they need to also be people that are, understanding as well. I'm very grateful that, that was all okay. So then Sunday night went to bed, and then Monday morning it was 3 a.m. My water actually broke and I was in bed, and I remember waking up and I had this pelvic pressure that was insane. It was like I could feel him kind of bobbing onto like maybe the side of my pelvic or top of
your hip.
Yeah, it's sort of close to there. And I was just like, oh, the heck. And I went back to sleep, and then it happened again. I woke up, and then I felt this elastic band just kind of like flicked like inside my belly, and then yeah, water broke. And I don't know why, but I just didn't think that was going to be the scenario that was going to start my labor. I'm so silly to say that because I was always of the mindset of like, you can't plan everything. So I've got to look at each scenario and how I'm going to go with those things. That was the one thing that I was like, oh, it's only a 10% chance that that's going to happen. And I just felt so silly for thinking that and saying that. But I must just had this mentality that I'm going to birth at home and I'm going to be at home for as long as I can and then go in to the hospital. And so I was kind of in disbelief that I had to go in to the hospital. And also when it happened, went to the bathroom. I was like, oh my gosh, this is real. Like, it's actually happening. But then I had meconium, and I had meconium really badly. Like it was big. I feel like I had a bit of a shutdown moment of, okay, that could mean the baby's in distress. That's not good. Like we need to go. And I obviously couldn't feel him move because I was so kind of erratic in what I was doing. I hadn't sat down properly to actually feel him kicking and things like that. And yeah, I really wish I didn't let stress come over me, but I did. And I think I'm also in hindsight really disheartened that I couldn't just call the hospital and be able to talk to the people that I needed to talk to rather than just the people that were there, because, it was 3 a.m. for one, not having MGP and that kind of thing. I was a bit upset by that. But in the one sense, I wanted to get him monitored, and I knew that with Breech, it's good to have the monitoring on the whole time. And I was very okay with that happening. And so we just kind of like collected the last of our stuff and then off we went. Such a weird feeling to be putting a towel between my legs and this water just coming out.
Did you put a plastic bag on the car seat just for extra protection?
I don't remember if I did that. I think I just had multiple towels and that was enough. Like, yeah, still, I probably should have. So much, like multiple pads. Yeah, I got to the hospital. It was like probably 3:30 at that stage. There wasn't really anyone to talk to, like the breech. They probably wanted to wait for the breech OB person to like wake up unless it was an emergency. So did all the usual checks and things like that, put the CTG on, baby was fine. And that was nice to know. And I needed that reassurance to be like, okay, we're okay. And I was 1 centimeter dilated and I was like, that's really awesome. Thought that was really cool. But then I started to feel like they were being really pushy, like, well, your water's broken, we have to make a decision. You've got meconium, you're not leaving here, and we want to induce you and augment the labor. And I was just very adamant. I was supposed to have a breech appointment on that day in the afternoon. And I had all these questions I wanted to ask, and I just needed more reassurance again. I was still going to go through with it either way, but I just needed to talk to the OB, and they were very pushy about it. And I was just continuously trying to buy time. They're like, can we put a cannula in? Nope. Just being on the defensive a little bit and trying to keep my little circle, because contractions hadn't started yet or anything like that. And it was hard because it was really nice being in the room when it was dark. So it was, probably 4:30, getting to 5 o'clock, and then we're watching the sunrise. That was quite nice. But it was just kind of annoying because they obviously had to keep coming in about things, like you have to do the DBS swab and all that kind of stuff. I guess they were being nice, but I don't know. A lot of the time they were just like, can you get on the bed? No, I don't really want to be on the bed. It just felt like I wanted to be in my own little home. I wanted to make it private, and I wanted to be able to be like, no, you're not allowed in, and like, but you can't really do that when you're at the hospital, unfortunately. And yeah, I wish that there wasn't as much disruption, but it was what it was, and we just kind of had to make the best out of it. And I think I was letting fear kind of take over. Like, I don't want to be induced, because I was very mindful of the stats on that. I don't want that cascade to happen where I just end up with a C-section. But part of me was getting worried. I was just kind of doubting it. I was like, what if I just went and got a C-section with my private OB? And so they called her and she was like, no, I'm not going to accept you because I don't want the risk of prolapse happening even in an ambulance going across to that hospital. And
Okay.
I'm glad that, yeah, she was just very risk averse. Yeah. But in hindsight, it was a good thing that she rejected me, because I was very keen on doing a vaginal breech birth. That was what I had always wanted. And I'm really glad that I didn't go down that route straight away, because my big thing was that I wanted to be able to trial labor and to start off that way and to not just have my choices be completely taken away from me. And it was just that scariness clouding my mind, unfortunately. And I was almost like it was a bit of a shock of, I didn't prepare for this scenario. I didn't think that meconium was ever going to be something, and I was worried that baby wasn't going to be okay. Spoiler, he was okay, so it's fine. But yeah, I mean, she also said on the phone, I think it was meant to be relayed to me, but after the fact, when I talked to her, she was like, your body's already gone into spontaneous labor. You're pretty much all the way there. You just got that little bit more to go. And she was very much trying to push me to go for the induction drip and just push things along. Message didn't get relayed, which I would have loved to have heard that at the time, because I just needed to talk to someone. There was no one else that sort of knew Breech as much. And I didn't get on the call and to the Breech OB until maybe 6 or 7. And so when I finally got a chance to talk to her, I was very pushy about it. I want to talk to her. She was just like, look, meconium happens with Breech, so I think it's more just the fact that he's Breech. And I didn't know that. I just kind of wish that I knew these things going in. And I was always very big on, education is very key. And
knowledge is power.
Yes, that's the word. Knowledge. And yeah, I was so annoyed that I didn't know. But yeah, I did have an innate trust that, okay, that's really great that my body was actually signaling I'm ready, a baby's ready. And that was really important to me as well. And she was also saying she thinks it's a good idea just to try doing the induction and see where things go. I don't know, it was almost like she wasn't saying that she was worried, but she didn't want to get to a point that we had to be worried. And so I eventually said yes to the induction drip. In hindsight, I wish that I didn't, but I am okay with how things played out because the induction drip didn't start until 9 a.m. And so that was a good 6 hours of being able to let my body kind of do its own thing. And I actually started to feel some really weak contractions, very weak, at 7 a.m. and then at 8 a.m. So things were starting, but I know that like things may, in hindsight, knowing, things might not have progressed. And I felt very lucky that they did progress for me.
And also that they offer induction as an option, because I know there's a lot of hospitals that don't when it's a breech baby. So it's good to know that it can be done.
And as much as they didn't want that to happen, like they didn't want to do induction. It was good that they did offer it. And I was feeling at peace with that because I think the breech OB was so like, it's okay. And I just needed her to tell me what to do and I was okay with doing it. So it was nice to know things worked out with the induction. After the fact, I've definitely made peace with it knowing it was an augmentation, not an induction, because my waters had already broken. So, my body already signified that I was ready and things were going to happen. Once the drip got in, I didn't expect things to be really fast. Should have known, but they were very fast. And I definitely felt the contractions be quite intense to the point that I probably only had a few that were 5 minutes apart and then they were going 2 minutes apart, and they were quite intense and really having to work through them and breathe through them and be on like the exercise ball. I was on all fours over it and using all of my tools, my breathing, and I had combs, I had spiky balls, I had my TENS machine.
Amazing.
Yeah, I really only wanted to use the gas was my plan for the whole birth. And also, one of my little things that I really enjoyed using from Core and Floor, she was really big on horse lips. And that was just like, I love the horse lips. Got me through so much and also just helpful to be able to breathe out, elongate that breathing. And another thing that really helped me was like seeing the wave of a contraction, like when it starts and you picture it and you climbing up the hill and then you're coming back down. And so that got me through quite a lot. But with Breech, they wanted you to have your CTG on the whole time. And I was okay with that. I wanted to know that baby wasn't in distress and that kind of thing. But it kept moving because I kept moving and baby kept moving. And so they had to keep coming in and like messing with that. And for a while there, they weren't able to get a reading. They were just picking up on my heart rate. And so the OB at the time, just a normal OB, was like, we're just not able to get a good heart rate. Can we do a fetal scalp electrode? Which was a fetal butt electrode, because they had to put it in his little butt. I was okay with that.
And it picked up the heart rate well?
It was perfect. Like, I've never got disturbed again. Didn't even realize it was there. I hated the fact that I had to be on the bed to be able to get that done and they had to time it and things like that. But I think by then I was 4 centimeters. She was able to check me then. And I feel like it had only been a few hours really. So that was amazing. Just, I had my birth preferences. I didn't really want to know how many centimeters I was, but now I was being told it and it was actually a really powerful thing. I was happy that I was told what I was. And then I continued on birthing. I think that at like increments, they were increasing the drip. But at some point, not that much later, I think because I had said like, I want to go in the bath. They were like, well, you're not allowed in the bath now that you've got the electrode. And I was like, okay, didn't know that. And then I was like, okay, shower. I just needed something more. And that was my next tool. And so the shower was great. But I remember them turning off the drip because I think I must have been getting quite a lot of contractions and it was probably at a point that they were happy with. And I remember the midwife saying, that's your body doing it. It's progressing because we've turned off the drip. And it was just such a lovely thing to have heard. Yeah. I think I was using all the different confidence that I could have had throughout it. And it was just really reassuring to know. But they were saying, we wanted you to have 4 contractions in 10 minutes. You were getting 6 in 10. And I was noticing that it was getting really, really intense. And I wasn't really getting that break, or they would ease and then another one would come. So it was definitely building to the point that it was crazy intense. So I had the gas at that point and I was gripping on something for dear life. And also I feel like mentally, from the start, I had it in my head like everything was going to be fine with the labor part of it. It was really just the end part of pushing him out that I was probably going to be a little bit more afraid and a little bit more concerned about how things were going to go. So I had it in my mind, this is all normal. And so I was dealing with that okay. I had my partner, I was just in the shower. He was holding the shower head on my back, and it was the best thing ever. And he was in front of me, he's like sitting down. So I was obviously able to see him. And that was such a helpful tool as well. I think just any help that you can get from your partner and any kind of, oxytocin that you can exchange during that time. And then I remember things just really building. So I was probably more kind of like an upright, like there was a shower chair and I was standing but leaning over onto that a little bit. So it wasn't quite on all fours, wasn't quite standing. And there was some contractions there that just felt like you had to move your body so intensely. I had no idea what was going on. It was just, this thing is taking over me. I have no control. I've just got to mentally deal with it. I mean, I knew that they were probably turning up the gas. I didn't know that at the time, but that was just really, I needed that thing. So that went on for a little bit. And then I noticed that I was in transition because I was just getting these feelings of, oh my gosh, I can't take this anymore. What am I doing? This is the worst thing ever. I need an epidural. Like it was all internal at that point, but it was just like, oh, I know this happens, and you just got to get through it. And I didn't expect to get to that point, but obviously it's a normal thing. And then I felt this unbelievable urge of laying down. And I sat with it for a bit and was like, is this actually happening? And I was like, oh yeah, it is. Like I felt like I was vomiting out my butt. That's like the only way to describe it. And so, yeah, I was just like, I think my body's pushing. And I knew that it was a big thing for me personally that I wanted to get checked before that happened, before I actually started doing anything. And they were like, okay, well, we need to check you. They needed to get me up onto the bed. I was like, no way. I don't really understand why they can't just check you, where you are, but that's what they needed. So we made our way over to the bed. Very hard to do that. But I think at one point when we were over to the bed, they didn't reconnect the gas thing, and I was just like losing it. It was really hard. But yeah, they checked me. They were like, you're at 8 centimeters, which I was really happy with at the time. I was like, that's great. And then they were just like, look, just try and stop that feeling. Try and stop that pushing. I was like, okay. I think the Breech OB had come in at that point and she was saying, yeah, like just try and stop that. And I think it's really funny. I love the little, funny tidbit moments of birth where she had come in and I was doing my horse lips. And so I had like finished like doing horse lips. She's like, oh, Lydia, how are you going? Like, and I was like, and she's like, oh yeah, you too. It was like the funniest thing ever. So she was like, I'm going to come back, and I can't remember how long she said, but it could have been half an hour, it could have been an hour, and she left. And so I was standing, or kind of like over the back of the bed, like I was on the bed, but it was upright. And so that was the position. And I was just like, oh, I just cannot stop this. There was no way. And I don't know whether it was like baby was just kind of twisting a little bit, or I'm not sure. But they definitely felt like they were moving down. And so I had kept saying that. And so she came back in the room and I was like, oh, has it been an hour yet? Whatever it was. She's like, no, it's been 5 minutes. It's something. And yeah. And she was just like, look, I know you didn't want an epidural because that was one of my things I didn't want. But the fact that you can't stop the pushing, I don't want to risk the head entrapment that we talked about. And so she's like, I would advise that. And I was like, yeah, do whatever. I was happy to do it. And it kind of just felt like I had this, urge to surrender to what needed to happen. And because she had expressed her concerns, I knew that that was a really real thing that could have gone wrong. And that could have been a really scary time, but it wasn't. I was very open to getting the epidural for those kinds of things. And so we managed to get that done really quickly. And I think part of the reason part of me was scared of birth was because of those interventions and because of those kind of things. Like I wanted there to be that kind of normal physiological process, and that didn't feel as scary, whereas, having the medical things did. But it actually was very welcomed, and I didn't feel scared of it at any point, really. Probably more so after the fact when I thought my back was sore from it, and then it wasn't. So everything was fine. And I'm very grateful that I had a good experience in that, because I know a lot of people talk about epidurals in, different ways. And yeah, so they were just like, okay, well, we'll get you up to, 10 centimeters. So yeah, pretty much they wanted to slow down the fetal ejection reflex because they didn't want baby coming through too soon with a not fully dilated cervix. And yeah, so they had me sitting upright. And yeah, I felt that nice tingly warm leg sensation. I did get really, really itchy though. So like that was annoying me like so much. I was like, I'd rather be like feeling contractions than feeling itch, like it's terrible. And yeah, we just kind of like sat there for a while and they did all their things they needed to do. And then they checked me. So that was apparently 2 p.m. I said that I wanted to push. And so the fact that it was only 9 till 2, like that was really not that long. And then sometime between, 2:30 and 4, they checked me at 4 and said that I was fully dilated then. And I know that when they put the epidural in, the Breech OB was saying, like, we'll turn it off before you need to push. So they were going to let me have an hour of descent where they wanted me to sit upright. And so they were going to let the baby move through the station. And then it got to, 4 p.m. and they were like, we're going to be here for an hour. And then I was definitely letting, like, because throughout my birth, when I had contractions, you are not really able to think. And I feel like in some ways I definitely wasn't present as much. But because I had the epidural and I was not in pain and nothing was really going on, I was like, oh, I'm actually feeling like a bit worried and scared now because like this was the part that I had to like really do a good job of and was a bit scary to me. But also equally as exciting because you're just like, I'm going to meet my baby. Like, this is just insane and crazy. I've never done anything like this before. But yeah, I found that a bit of an uneasy thing. I don't know whether it was just, when I was starting to push before, it was like, oh, this is easy. I can do this. What could have been done because I was able to think about it. It was harder. So I guess this is the part where like there are some things I wish didn't happen. So there was a bit of miscommunication between the midwives and the OB, and they didn't hear the message that we were supposed to turn it off at a certain point. So they let the epidural keep coming in, and there was a bolus like right before like we wanted to wrap up, so right before that 5 p.m. mark. And I don't know why neither of us said anything, like we just weren't really thinking. I mean, it wasn't really all our responsibility as well. But yeah, when the OB came in, she's like, no, turn that right off. Like you're supposed to turn it off. And it was a bit upsetting, I think, in that way that, you kind of put your trust in people and kind of let you down a little bit. But, if that was the worst that could happen, then, it's not that bad. So, because I didn't want an epidural, I never ever thought about what would be the birthing positions for when you have an epidural. And I think it must have just been a combination of because they, there was more epidural in me than, she had wanted. I had to be on my back. She was like, this is going to be the best position for you. And I was just so mindful of like anything that I had read or anything that I had consumed, birth courses and things like that talked about breech, which was awesome that they did. They were just like, no, physiological is the way. And I mean, I know that the breech OB, like I was asking about like, can epidurals happen? She's like, yeah, they can. It's okay if you get them. And so it was nice to know that she was skilled in that. But they were just very much like, you want to be in an open position, you want to be in an upright position because that's going to be where there's the most room. And so I was definitely upset about that. But nonetheless, like it was still a beautiful experience to be able to push a baby out.
Did you get any sensation to push with that epidural? Or did you need that support to know when to push?
Yeah, I definitely needed the support. I could feel a little bit, like it was definitely like just there in my tailbone, a little bit. But I could feel where I was pushing into. I just didn't know when to. So yeah, I needed to be really guided. And they were, happy to do that. And talking me through everything. And we're all just like counting and pushing. And so, yeah, that started at 5 p.m. pretty much. And she was like, we're going to let you have an hour of pushing, like maximum. I don't think she really ever said, and then we'll take you off to theatre if things aren't happening. But I knew that was, going to be probably the next thing. And I had read some papers. I knew that the hour was sort of where it was at, according to the papers. So yeah, it was nice to know I already knew that. So she was just confirming it. Yes. There were some funny parts of the birth. So when it came to actually like starting to push, so the baby's a boy, his testicles had already started coming out and they were saying to my partner, like, do you want to come and look? And he's like, oh, sure. Okay. But it was just such a weird, funny moment.
Did you know what you were having? Was it a surprise?
Yes, we did.
Okay.
Yeah, they were very careful. Even when I was getting checked, they were just like, do you know what you're having?" I was, "Yeah." It's like, "Yeah, I can touch your baby's
Yeah.
testicles," and I thought it was really funny.
The surprise is pretty quickly over for those that end up with a breech baby. You're like, oh, already can see it.
Yeah, it's very obvious. um, but yeah, I definitely didn't want to watch anything else, just trying to mentally stay in check. And so started pushing at 5, and I've got my little notes here because the end part of it isn't something that I remember all. I feel like I
Yeah.
remember it differently to what's written down. But yeah, we're pushing, and I remember it like the OB kind of saying like, hold that pressure. Like it was obviously in between the contractions. And she was very stern about it. Like really, you could kind of tell that she was, really wanting me to push like with everything that I had. I didn't really know the reason until after, but it's got written on my birth notes at 5:15 they started getting the um the fetal distress like a little bit. So I'm assuming that's when the core compression started.
Yeah.
And that's when they were probably marking, hey, we need to like, get this baby out quickly, with whatever rules that they had with the timings. And I know that upon like I'm the kind of person that likes to read stuff later. We don't really know like fully how long the babies can do okay with like some say up to 10 minutes. But they had that 5 to 7 minute rule. And so I think things were pretty quickly after that. Like actually before that, baby was posterior. And right before I started pushing, they're like, "Oh, baby's moved to a good position now." Like they were round the other way. So that was really nice to know that, somewhere in between there, he was like, "Yep, I know how to get out." Like I thought it was really cool.
Yeah.
So she'd said that she wanted to do an episiotomy. So that would have been 5 minutes later after the 5 minutes of distress. And I don't know if it's because like I know during the end of my pregnancy, because I got so disheartened with C-section being thrown around. I know I didn't really give my massages like a really decent go. I was definitely, trying to do it as best I can, but I was a bit loose with it. And so I don't know whether that played a role, whether she just didn't think it was going to stretch that well, or whether it's like, we need baby out right now. And I was okay with that happening. I knew that there was going to be a chance. I wasn't fully against them. And I knew that also just being in that position was going to be more likely that I would need some kind of intervention. So it was just one of those unfortunate things. But again, happy to do it, surrendering to the process. So I think that was at 5:20, and so it's 5:27, his sacrum was delivered. So that's nice to know that his butt had, and people say that's the hardest part, to get the butt to come. And then after that, apparently the knees were flexed when they came out. So he must have been complete breech, and put his legs down, which was interesting that he decided to do that. And then so butt came out, and then his knees came out, body out, and then they did a maneuver to help facilitate like his trunk and arms and shoulders to come out. So she did that maneuver, and then a minute later helped deliver the head with another maneuver. And then he was out, and then he got plonked on my stomach, and it was such a surreal feeling of like, oh my God, like I felt his head kind of plop out of me. And
Yeah.
it was just like, yeah, it was beautiful to, oh my gosh, like he's actually here and he was on me. And I knew that there was that thing about them being limp. So I was trying not to worry too much. And if anything, I was probably very distracted, like, oh my gosh, he's here. Like, this is him. And their midwives were like, yeah, like blowing his head. And they were trying to stimulate him. And it had probably been a bit less than a minute at that point. And yeah, he wasn't making noise or anything. So the midwife decided to cut the cord. And she said after me, I just needed to make a decision. And that was what I did. But as soon as they lifted him off me, he started crying. And I was, damn. Because I feel like a delayed cord was something that meant a lot to me personally. But I definitely have found that I've had to be really compassionate with anything that happens like that, because I feel like I'm in no state of mind to be like, no, can we wait? And I don't know the history of what just happened. I didn't know that the baby was in distress. I could tell that something was going on, and she was very like, we need to get this baby out. But yeah, it was only like 28 minutes of pushing all up, which I thought was a really good effort.
Yeah, especially with the epidural on board.
Yeah. So I think I surprised myself, and even the team was just like in awe of that, which was really lovely to hear. So as soon as he started crying, they did end up taking him away just for a little bit to get him checked, but they brought him back really quickly, and he was all okay and all fine. And it was so beautiful, even though I feel like things would have been really scary and didn't happen how I wanted them to. The fact that I was able to have a vaginal breech birth, like that to me was insane, and it was against like what other people had wanted to project onto me and wanted to say. And I was even just in awe of the process of like, okay, he can be okay without oxygen for a little bit. And, you know, he's this thriving, beautiful boy. Yeah, I mean, I feel like the rest is a blur, but I think one of the other things that took me by surprise was he was so soft. He was so beautifully soft. And I just kept like patting him as if he was a cat, but he was not a cat. And then they were like, yeah, doing the whole placental birth, like dealing with that.
So did you have the injection for that?
Yeah, so I did have the injection for that. I had on my preferences, which I feel like, again, I don't know whether they just weren't properly read or, you know, just a bit disregarded, which was upsetting in the end. But I wanted the choice to either have the injection or not. But I know that after researching it after the fact that, they pretty much, like with hospitals, if you've had the induction drip, they pretty much just assume like this is our protocol, we're doing this. And so I remember asking about it, like, oh yeah, are we doing the injection or she's like, I've already given it to you. And it's like, you didn't tell me that. Like, I think that was just a little bit sad.
Yeah. Yeah. For those listening, it might be the recommendation and the protocol to do after augmentation, but it still requires consent. So I want to make that really clear to listeners.
Yeah. So that was something that really upset me. And I don't know why it is that way. And I don't know if it would have been the same if, you know, my original OB would have been in the room, for example, like the private one, and I don't really know where even the breech OB's head was at, kind of. Even just with the cutting of the cord, like maybe she was worried too. But I think I felt a little bit like, why'd you do that then? Like, why didn't you at least ask me before you injected me with something? Just because I got an epidural doesn't mean, yeah, because I can't feel it.
Yeah.
But I've definitely kind of accepted the fact that like maybe I wasn't meant to, maybe it was the best thing that could have happened. And I know like second baby, it will definitely be one of the things that I'll be like, you're not coming near me. And so, yeah, they did the active management of that. They did like the pulling and the compression massage, sorry, on your belly. And it was just nice because I was obviously distracted the whole time, and then stitched me up. And I remember asking about like, how many stitches? And they're like, it's just a running stitch. And still like every time I got checked from those stitches, I had compliments of like, it's just a really neat stitch and really neatly done. And I was like, that's just really nice to know, because this particular OB who was stitching me up was saying that she was really proud of like her own work. And it was just nice to know how much she cared.
And did you breastfeed? The first breastfeed, did you get that?
I did. So it wasn't too much longer, I think, when we started the breastfeed. It was very like much they kind of helped grab baby and put the baby on, sucking a little bit, but it was definitely a bit harder than I imagined. I think I was still a bit in shock of like, oh gosh, what is going on here? But it was, yeah, a very beautiful experience. And had a shower after and went back to our room. So baby was measuring just under 10th percentile when he was born. So it was 9.6. And because of that, they had him have him on blood sugar checks. So every time he needed to get fed, he had to have his blood sugar checked before he got fed. So unfortunately, a few hours later, he actually did have a blood sugar crash. And that was very stressful, because then he had to get an extra, like he had to do a proper one where they did the skin prick to get blood. And then I was pretty much on express and colostrum for like the whole night between that and feeding him. And I definitely found it hard because I was in the public hospital for the night. I found it hard because I could tell how busy they were, and I had to like buzz them every time I thought he was hungry, and they had to do the tests. But fortunately, it was only once that his blood sugar crashed and they gave him the glucose, we gave him extra colostrum. And ever since then, he fed more, and he didn't even end up losing that much weight. Like, I know they allow the 10% for them to drop, but he only dropped like 30 grams or something, which was really not much. So feeding went really well after that. I feel like it was just one of those things you both had to work out. Like he would suck and then he would stop and then he would suck and stop. And that was a bit awkward at first. But as soon as I was across to the private hospital the next day, they had their proper consultants and they were so helpful and hands-on with breastfeeding. And we just got the hang of it ever since then. And I loved my experience at the private hospital. So that was really nice. I guess, yeah, as a whole, I was just like in complete like awe of what just happened. And so over the moon. When I went to go check in to the private hospital, they were like, "We thought you were checking out because you seem so happy and everything." And they honestly treated me like a bit of a celebrity over there because they're like, "Vaginal Beach Bear," because they obviously don't see them. And it was just amazing, amazing feeling. But even I felt like I was over the moon, like I didn't have to have surgery, and also just what just happened to me, like that was crazy.
Yeah.
Even though there was a lot of things that, didn't go straightforward.
And so how many days were you in the private hospital postpartum before you went home?
So I was there for 3.5-ish days. So 3 nights, which, yeah, was really nice to spend time there and learn. Like they had so much stuff to learn there. They had talks on breastfeeding and settling. And I loved my experience with the private. Just unfortunate they didn't offer the birth that I wanted.
Yeah.
But I feel like I was really well set up for how my postpartum period was going to go because I'd never had a baby before. I hadn't really been around that many young babies. And so that experience was the best, and the midwives were so helpful and lovely. But yeah, I feel like that's sort of, as a whole, my birth story.
Yeah, amazing. And what was your postpartum once you went home? How did that look? Did you have much support? Did you have any issues healing for yourself? Did Bub need any support?
So at first I was just really happy to be home because like being at the hospital, sleep was a hard thing to get during the day. So I had a lot of support. Like my mum made me so much food. She came over. I feel like anyone who came to visit was just really lovely and helpful and what I needed. But in terms of recovery, my episiotomy ended up getting infected. So that was just unfortunate. And I ended up needing to go on antibiotics for that. And I went on a few different rounds of antibiotics. So I think I was a bit disheartened that that happened. And then from there, I think because I had gone on antibiotics, I then got breast thrush, just because there's that imbalance of bacteria and stuff. That was a really hard journey with feeling like my nipples were having a lot more pain. But yeah, in terms of baby, like he was doing great. I feel like it's hard also to look back at that time because it was 14 months ago now. Everything in terms of baby was going really well. Obviously, like the newborn challenges that you have with settling them and then waking up so much, it was just really intense, needing to sleep a lot. And there was a period, I think it was probably like 3 weeks postpartum, where I passed a blood clot, probably like the size of a date. And I knew that I didn't have to be too worried unless it was bigger than that or multiple. But I called the hospital anyway and they reassured me, and it was nice to get that reassurance. It's just such a vulnerable time. And even with recovering, I felt like I had that emotional, like where you just cried everything, the baby blues, probably for a lot longer than I thought, like 3-4 weeks or even more. But it definitely leveled out and became a lot more manageable after that. But for the most part, I was just on this cloud high of like, oh my gosh, I have a baby and this is so beautiful, and gives you a purpose, which I'm really thankful for. Definitely, recovery wasn't as linear as I thought it was going to be, but I didn't have anything major, which was good.
Yeah, it's a whole nother journey. Once you get through the birth, you're like, oh, now I've got to learn this and this.
Yeah, how to be a mum and how to take care. Like you're just like in the deepest water ever.
With your experience, did you feel empowered with your birth choice?
I definitely did. I felt like there was a bit of control taken away from me when it was just like, we only offer C-section. I felt empowered that I was still able to go through with a vaginal beach birth and that there were skilled practitioners. I know it sounds sort of weird in hindsight thinking that I would feel empowered when I had a lot of things kind of happen and pop up that I didn't really have control over and choice, but I still felt like I still felt like I did somehow.
And knowing what you know now and having the experience that you've had, would you do anything differently if you got pregnant again and had another breech baby?
Yeah. So I feel like I have that confidence now that I know that I can birth a baby, that I'm probably not as worried and scared about that. So I want to say that if my water broke and I was at home and I didn't have contractions, that I would stay home longer. Um, and that I wouldn't accept an induction drip. And I would probably be more hard ass of like, nope, leave me alone for X amount of time and buy a lot more time. And I would probably be a lot more adamant about, no, I'm birthing on my hands and knees or upright or whatever the position was. Yeah, I want to say that that would be my things that I would change. And even if I couldn't feel my legs, I would be making sure that someone was holding me or doing something. And just listening to my body a little bit more. That's what I would do, yeah.
Yeah, beautiful. Thank you. Do you have any resources that you would recommend to anyone listening that might have a breech baby on board?
So in terms of what I use, the podcast, the Birth Rebellion was really, really great. And I think they've even changed how they structure episodes now. I think that they're just like really, really great. And I think off the back of that, I really loved Floor&restore. She was a co-host at one stage.
Yes.
But she had her own antenatal classes, which were just filmed like during a lockdown. I just loved the way that she talked about birth, and it was just so beautiful and helpful, and just like it was a normal process that happens, and it totally is. I would say give that a listen, but also with Breech specifically. I know this is just probably for Australians, but I'm sure you can still join the group on Facebook about Breech Birth Australia. And that was definitely something that was so key in my journey, because people just talked about their experience on there and what they went through, and you could hear other people's birth stories and even just any guidance. Like, I still love patrolling on there to help other people not feel how I felt. So yeah, that one is definitely a key resource.
Yeah, perfect. Great. Any last words of wisdom or advice you'd like to give to anyone with a breech baby?
Oh my gosh, you can do it. I know the fear of the unknown is always going to be there, but trust your gut. And if that's something that you really want to do, then do it. And I know it's really hard because like I found a skilled provider. And so I'm really hoping that these people can find a skilled provider. And I feel like that the rest should be, they can put their trust in them. And I would love to say advocate as much as you can, but also know when to lean on the right people as well. Yeah.
Perfect. Beautiful way to finish. Thank you so much for coming and sharing your story.
Thank you. Thanks so much for having me and taking the time out to make this and to chat to all the people who've had these experiences. I still get a kick out of knowing that I birthed a breech baby, because like the other day I had a run-in with a doctor and they were just like, did you have a normal delivery? I'm like, what does that mean?
Yeah.
I was just like, it was breech.
What's your definition of normal?
Yeah, exactly. But even then it's just like, oh, so you had a C-section. No, they're like, how? It's still something that I'm going to carry with me for life. And I know that that's what birth is to women. And I feel really, really sad for people that don't have good experiences. But yeah, it's like the most life-changing thing ever.
Yeah, beautiful. Thank you.
Thank you so much.
Thank you for listening to the Breech Birth podcast. These stories matter. They stretch what we think we know and bring voice to experiences that need to be heard. I'm so grateful to the women who have shared their experiences with us, raw, real, and full of wisdom. If this episode resonated with you, please follow, share, or leave a review. You can find us on Instagram, Facebook, and YouTube at Breech Birth Podcast. And if you have a breech story to share, I'd love to hear from you. Until next time, may we continue to reclaim the narrative, one story at a time.